Hi, good afternoon, everyone. So it's our expert opinion again, but as you can see, today is a little bit different, right? Because it is the first time that the student of Penang International Dental College, we are taking the initiative to host this event for you guys. So I'm your host today. I'm Theo, a Year 5 student for PIDC, and I'm also the president for PIDC Virtual Circle. And this is my co-host today.
Hello everyone, my name is Amalia Akilah binti Abdul Aziz and I'm a fourth year dental student here in PIDC. It is indeed my great pleasure to introduce the speaker, or shall I say the expert for today's session, Dr. Kalyan Chakravarthy, who is also the head of Department of Conservative Dentistry and Endodontics here in Penang International Dental College. Thank you, sir, for spending some time with us today.
Thank you, Theo. Thank you, Amalia, for your kind introduction. Hope I'll try to my level best to answer all the questions you will be asking about root canal treatment.
Okay, sir. So let's dive in straight to our topic today. And it's a really interesting topic because it happens to like most of us. And I think like every one of us in some point in our life we have done this or get to know someone with this condition. So today, our topic is root canal treatment, or in Mandarin we say 抽牙根. And I believe there's a term for that in Bahasa Melayu as well, right, Amalia?
Yeah, I think it is called rawatan saluran akar.
Yes.
Yeah. So, sir, when we talk about RCT, a lot of our patients get confused. They don't understand what is a root canal treatment or the RCT we keep bring out to them. So, can you give us some brief explanation?
Yes. Okay. Root canal treatment is a procedure usually prescribed when a natural tooth gets irreversibly damaged or infected, and we want to save this natural tooth and keep it inside the oral cavity for a very long time functioning well. We prescribe root canal treatment.
Then what is the procedure like? Is there for doing the root canal treatment? So
yeah, there are the procedures. If you look at root canal treatment, okay, so whenever a tooth I want to use this model here. Can you zoom in, please? Okay, and more. Yeah, okay, if you can look at this picture, whenever a tooth gets infected, okay, or there's a cavity, big cavity there, and the infection reaches the inside soft tissue, what we call it as a pulp tissue, it gets irreversibly damaged. So what we do here is that we'll make an opening inside the tooth, okay, locate these roots which are damaged or infected. We use very slender instruments called files to clean these root canals very carefully, disinfect all these root canals. After carefully cleaning and disinfecting, we fill these root canals, okay, so that reinfection does not occur. So once the root canal filling is done, the opening which we have created initially, we seal it off, okay, so that reinfection does not happen. And if required, we give a crown to strengthen the tooth which has been root canal treated.
So, sir, you are saying that we are going to remove the soft tissue or the live tissue inside the tooth, yes, and replace it with something else.
Yes. So why do we do that? Okay. Once we remove the soft tissue, okay, the pulp, which we call as a pulp tissue, has been removed. Okay, there is a dead space inside the tooth. Okay, and this dead space can again be recolonized by the bacteria. So we do not want the reinfection. So we want to close all the portals of entry as well as exit. So we seal that with material.
I see. So, sir, how does a person know that he or she has to go for root canal treatment? Is there any specific signs and symptoms for that matter?
There are, means if a person experiences some signs and symptoms, okay, they need to identify these signs and symptoms. Okay, I'll try to list out these signs and symptoms. The first sign is usually if the patient experiences any type of lingering type of pain, okay, lingering or a continuous sensitivity. If they take something very cold or something very hot, and this pain still is there after they stop taking this cold or heat or hot beverages or something like that. Okay, and this pain may be sometimes very severe to some patients. Okay, it can be very continuous. Even after they take painkillers, it will subside until the painkillers are effective, and then the pain comes back again. Okay, they may also have pain when they do their routine activities like going to job, going to school, okay, or doing their daily activities, or else they can have pain when they are sleeping or lying down. Okay, if they notice their tooth is slowly getting discolored, or if they notice is there any gum boil or a pimple near the tooth. Yeah, that's it.
I thought pimple is only going to appear on your face.
That's a layman term which we use to tell the patient, okay, that is like a sinus opening in the technical terms. What we call, if you notice anything like a gum boil or a pimple on the gums near the tooth, which we are posing them problem, okay, or else if they notice any crack or fracture on the tooth or difficulty in biting and chewing. So there is a list of these signs and symptoms. If they notice some of these signs and symptoms, they need to go to the dentist for advice.
I see.
So if you're experiencing pain that like disturbing you, you cannot do your daily routine, that is a good time for you to come and visit one of the dental institute nearby. And sir, so now I have like some doubts in the appointment, because we have this kind of concept that for root canal treatment to be done, it's going to take you maybe the whole afternoon or maybe the whole morning. So
Okay.
can you give us some idea for that?
Usually the root canal treatment lasts for 1 or 2 appointments. Okay, 1 or 2 appointments. Maybe if the pain do not subside, it may go for 3 appointments. And each appointment lasts for 45 minutes to 1 hour. So after the root canal treatment, 1 or 2 appointments. Later on, if crown is required, it will be 1 or 2 more appointments.
I see. Okay, so the term RCT, it usually provokes fear to the patients. Why is it so? Is there any like misconceptions regarding RCT that make them scared?
Root canal treatment as such is not a painful procedure. Okay, before we do a root canal treatment, we give local anesthesia. Okay, so this pain with local anesthesia is with any other dental procedures, like if you are doing a filling which is very deep, or we are doing an extraction or an implant or cutting for a crown or something like that, we still give anesthesia. So the pain is same like any other dental procedure. But sometimes some patients may experience slightly more pain in between the appointments or after the treatment. Sometimes.
After the treatment.
It means not always, sometimes, okay, but this pain is very transitional. Okay, it's for a very short time. It will reduce over a period of time. Okay, and it does not affect the overall success of the root canal treatment.
Okay, talking about the success rate, is there any difference between success rate and also survival rate of the treatment?
Yeah, success rate and survival rate are two different terms when we decide about any dental treatment or for such any treatment. Okay, success rate is based upon very strict parameters which we look at, that we should stick to these parameters. Okay, when we are assessing any treatment, whereas survival rate means how long after the procedure has been done, the tooth is retained inside the oral cavity. So success rate may be lower, but the survival rate may be longer for any tooth.
So here comes the important question. So I want to ask this, like in representing all our audience, what is the usual survival rate for a root canal treated tooth?
Oh, that
can it last for 5 years, 10 years, or something?
That's a very tricky question. Okay, survival rate. If I have to quote some evidence for this one, the 10-year survival rate of a root canal treated tooth ranges from 82% to 94%. Okay. 82% to 94%. Okay, so it may also differ based upon the training or the practice of the person who is doing the procedure.
So in layman terms, like how long can I expect my tooth to be retained in my mouth?
If the root canal treatment has been done properly, okay, that means the infection has been taken out, okay, crown has been given, or the restoration has been given properly, it should stay for a long time, minimum 10 years, 15 years, or 20 years. Okay, because I've been doing root canal treatment at the current institute PIDC from 2009. That would be like 12 years. Okay, so it's not that a very often patient comes back for revision of the root canal treatment or retreatment. So that's a good thing. So success rate is pretty good with root canal treated too.
And also, we often get asked, like when we explain the RCT to our patient, they have a concept that their tooth is dead after the root canal treatment. So is that true, sir?
No, it's not true. Okay. If we look at, okay, I'll try to explain through this model. Okay, can you zoom in a little bit? Okay, thank you. If we look at this model, okay, which is a tooth model, the tooth has got an outer covering, which is usually the enamel, okay, white covering. Inside this white covering, we have got an yellow covering, which is again a hard covering, which is got dentine. And inside the dentine, we got soft tissue here, okay. This soft tissue has got blood vessels and nerves, which we call pulp, okay. So this pulp is usually helpful for the tooth during the formation stage, okay. It supplies the nutrients. So if this pulp gets infected or irreversibly inflamed, then we remove this pulp tissue and do root canal treatment. But still, we have to remember that this tooth will be still receiving nutrition from the arteries, from the bone, as well as the gum tissue, that is the gingiva, okay. So still the tooth is alive, getting its nutrition from the bone, which is the main supply to the tooth, okay. So it's not a dead tooth, it's still alive, and it can function normally inside the oral cavity.
Means that the tooth is getting all the normal sensation?
Yes. Okay. A root canal treated tooth can still have natural sensation when you're biting, okay. That is not possible with other procedures like implant, okay. But we cannot compare root canal treatment with implants, because its comparison is like comparing apples with oranges. So both different. Both are different.
Okay. So we have one question from the audience. What is the cost for RCT? Yeah.
The root canal treatment cost, it varies, okay. We usually follow the price range which has been given by Malaysian Dental Council, okay. So all the dental clinics are supposed to put up their charges, okay, at the waiting areas. So we follow, it ranges from 600 to 700 to 1000, 1200 or something like that. And also it depends upon which tooth you are doing. If it is a tooth anterior or the front tooth, the incisors of the canines which have got single canal, they are of lesser price. And if they are molars, the back tooth, which is more difficult to do perform root canal treatment, the cost is slightly higher.
Yeah. Then, sir, I want to bring up another question, because a lot of patients, they think that root canal treatment can only be done by a specialist. And is there any difference between the procedure done by a general practitioner and the procedure done by a specialist?
That's an interesting question. As a dental student, okay, when they are training, all the students have been trained in doing root canal treatments, okay. And over a period of time with practice, they are able to do root canal treatment, okay. Yeah. So most of the dental practitioners, okay, I can say with training as well as with practice over a period of time, will be able to do root canal treatments. Only if it is beyond their scope, or it becomes difficult, or it may require retreatment or revision, then they usually refer to us, to specialists, for doing such root canal treatments.
So the following question, sir, the audience asks, does this procedure is covered by insurance, like medical card?
It is usually covered by insurance, this procedure.
And
also we have Mukta Kamilpur, who is asking, greetings, sir, what is your opinion regarding single visit RCT?
Okay, now again, the root canal be done in one appointment, which is called single visit RCT, or does it require multiple appointments? Nowadays, most of the root canal treatments are done in single appointment, okay. If there is tooth is not necrose, okay, the pulp tissue inside, what we have necrose means totally spoiled, and infection has gone beyond the apex of the tooth into the bone tissue, we do in multiple settings, more than one. If the infection has only entered into the pulp tissue and there are no signs that it has entered into the bone, okay, or periapical area, we call it technically, then we do in single appointment, okay. There is no difference, or evidence does not say that the success rate is less for single visit root canal treatment, okay. The lesser the times we open the tooth, the lesser the chances of contamination and higher the success rate. So nowadays, it is advised to do the root canal treatment in as much less appointments as possible.
Then, sir, I have a question regarding to that. So usually we will give 2 appointments to our patient, right?
Yeah.
For like maybe most of the case. And my friend asked me, what will happen if he went for the first appointment and he has get the tooth open and the dentist put something inside. What happened if this patient failed to attend the second appointment? Is there going to be any sequelae or consequence for that?
Okay, that's a tricky question again. If the patient has attended one appointment and is unable to go for the next appointment, what will happen? If during the first appointment, usually the dentist will clean and disinfect the entire root canal treatment, and in the second appointment, he will post for filling of the root canal treatment, or filling it. Okay, if the tooth is not painful in between the appointments, okay, if the temporary filling or the temporary dressing has not dislodged, okay, it should be still okay to have some gap, okay, if it is unavoidable. But if the temporary filling is dislodged, that means once the temporary filling is dislodged, then you have recontamination of the sterile cavity what we have prepared, okay, with bacteria, as well as if the patient has pain, then we again need to re-clean the entire root canal and place a dressing and seal it.
Oh,
Yeah.
so it's
So it may
better,
prolong the root canal treatment
so it's
procedure.
better for the patient to come for the second
Yes.
appointment.
Yeah,
Okay,
but
guys,
since
stop running away, guys.
but the situation right now, COVID-19,
Yeah.
no one can expect anything,
That
right?
also
So
contribute to something.
if they have to redo the whole RCT treatment, meaning that their appointment would be even more than before.
Okay, redoing or revision of root canal treatment, that's a totally different technique. Okay, if suppose say a root canal treatment after some years again reinfects, okay, and we need to do a repair or redo the root canal treatment, okay, it may take one more appointment or something like that. It may or may not be. Again, the procedure is slightly different. We take out the crown, we remove the root canal filling which is there, and from there on, after removing the root canal filling, we again very carefully disinfect, clean the entire root canal, and then we refill it.
So I
Okay.
can see the disinfection is the crucial part
Yes.
for root canal treatment.
Yes, you're
And
right.
so we can see there are a lot of questions posted by our audience there. So let's look at them. So from Zixin, may I know why some of the teeth turn black after RCT treatment? Is it a thing, sir?
Sometimes, okay, sometimes it's not always nowadays not there. Okay, after root canal treatment, we use the cements, okay, the cements which we call it as sealers or the filling materials. They might discolor over a period of time and it can be reflected through the root canal. Okay, so but nowadays with the newer material, most are very aesthetic, it's not a problem. Okay, so sometimes with the
Sometimes.
yeah.
So if it happens, is there anything we can do to like
Less
get
than-
better aesthetic?
Yeah, if the tooth gets discolored after root canal treatment, we can do something which we call as bleaching. Okay, that means we call that one as intracoronal bleaching. So we place a bleaching agent inside the tooth, okay, and seal it off for a week or two, and later on this bleaching agent will slowly lighten the stain which is there.
Bleaching agent.
Yeah,
I thought we only use that for your clothes.
No.
So
Okay.
like what kind of bleaching agent we are putting in? Is it
Yeah, these bleaching agents are safe, okay, with very minimal concentration which has been allowed by Malaysian Dental Council. Okay, usually it is hydrogen peroxide or carbamide peroxide in allowable concentration.
I see.
okay? So now let's pick up another question from the audience. So which one do you think is interesting for you to answer?
Go to the next one.
There's one question there from Saurabh Agarwal. Greetings, Dr. Kalyan. Is it a must to put a crown after RCT?
Yeah,
Okay.
we also get asked this kind of question a lot. Like, do we really need to get that from our patient?
Yeah, again, it depends upon before we start the root canal during the planning stage. Okay. If we assess the tooth before we start the root canal treatment, that how much tooth will be left after removing the entire decay and after we prepare an opening for the root canal treatment. Okay, if sufficient, we feel that if sufficient tooth structure is there from all the sides, we can go for a direct filling. Okay, even for the back tooth nowadays, with improvement of these adhesive materials, we can go for a direct filling. But If the tooth structure is less, that means less than 3 walls are there, and we consider that the tooth will be less and it requires more reinforcement, then we suggest a crown after root canal treatment.
Oh, so the crown is acting like a reinforcement structure.
Yes. So the crown will act like a reinforcement. It also will restore the actual shape of the tooth and help in biting and chewing.
Okay.
Shall we go to the next question, sir?
Okay, sure.
What should I expect after a root canal treatment by Nolan?
What should I expect after root canal treatment? Okay, what should I expect? Okay, you should expect that your tooth should function normally, okay, without any pain, okay, and you should be able to do the regular normal mastication. If you are talking about will there be any pain after root canal treatment, okay, or this is a question like what instructions will be given. So usually after root canal treatment, if we are given anesthesia, we ask the patient not to bite anything hard or chew from the side until the numbness wears off. Okay. After that one, they can start biting. Okay. If they experience any pain, usually we prescribe analgesic, which should reduce. If the pain is still persisting and it is beyond tolerable limits, we ask the patient to immediately report back to the clinic. So for advice. Yeah.
When it comes to pain, there is a term called hot tooth.
Hot tooth,
right?
yes.
Yeah. So what does that mean actually?
Hot tooth means sometimes the pulp tissue which is there inside this hard tissue is very inflamed, okay, and the pain is very severe, okay. To some patients, they feel it is very severe. Even we give anesthesia, still the patient will have pain. So what we do is that a normal anesthesia, if it is not sufficient, then we take more help. We give a block anesthesia or intraligamentary, intrapulpal. So we add more anesthesia techniques to control the pain. But this pain will persist until we take out that pulp tissue from the tooth.
Oh, I think that's a bad news for the audience.
Okay.
Okay. Another, wow, we are getting a lot of response from the audience now. Let's look at it. Maybe from Dennis Chan. How many times can a tooth go for re-RCT?
Oh, how many times?
But usually we hope that we no need to do for.
Okay,
re-RCT,
this question is different. Okay, re-RCT or revision of the RCT. Okay, if the tooth gets again reinfected because of any reason, means it's not properly cleaned, or else some root canals have been missed or something like that. Okay, then we can go for re-RCT. Okay, how many times will we go for re-RCT? Okay, even if the second time fails, we may go for the third time. But again, it all depends upon the tooth structure which is left. Okay, can it after we do these procedures, is it strong enough to stay inside the oral cavity and function normally for a longer time with the crown? Okay, if we feel that the tooth is very weak, then we will not be able to save or salvage the tooth.
So then that brings me to another question. Let's say the tooth has been RCT treated, and now my dentist tell me that my tooth is not salvageable, cannot be saved anymore. So what are the other options we can go for once our tooth is not?
Okay, once the tooth cannot be saved, now you're saying that after the root canal treatment, it's failed, and it needs extraction because it's totally in a hopeless condition. Okay, there are many alternatives. Now we want to replace the missing tooth. Then we can go for a denture. Okay, that could be like a denture which is not very stable, or else we can go for a bridge. Okay, the bridge will replace the missing tooth and can take the support of the adjacent unaffected tooth. Okay, we give crowns on the unaffected tooth. That's called as a bridge, or else a single tooth implant. Okay, single tooth implant. Each are different. They are different techniques, different costs. Okay, so it depends on the need of the patient. So either it can be implant or a bridge.
So I'd like to address the question by Charlie. Yeah. Charlie Teo. Yeah. He mentioned after a successful root canal treatment, what likely is the chance of the issue to happen again? So success rate.
Yeah, again we come back to the same one. Okay, A tooth root canal treatment is called successful, okay, if it satisfied some criteria. That means all the roots have been thoroughly cleaned, shaped, and filled up to the tip of the tooth. We call it as like 1 millimeter short from the tip of the root, okay. And over a period of time, if I take a review radiographs, the lesion which is there has to be shown healing, okay, within 2 years, okay. So it's a time frame will decide is it successful or not, okay. If there is a lesion after 2 years, it shows complete resolution, that means it's a success. If it is not showing resolution, then it is not a success, okay. We may have to revisit or retreat the root canal.
All right. Shall we go to the next question? There are plenty of questions
Yeah,
here.
plenty of questions. I hope I don't miss some of them.
Umi Amira asked, is there any difference in success rate of RCT done by dental student and also lecturer?
Yeah, because this is also one of the main concern of our patient here in PIDC.
That's a question. Is there any, there might be some difference, okay. There might be some difference, okay, because any dental procedure we need training as well as practice, okay. Over a period of time they will gain practice to do the procedure, but most of the procedures are done under supervision here, okay. So when they are doing a procedure, uh, student, be it a root canal treatment, they do under direct supervision of the specialist, so which take the proper care has been taken so that the procedure is done properly. So there might not be any difference in the procedure per se itself.
Yeah, and for students from our own experience, we might be even more extra careful while
Yes,
performing.
that is what I have seen. When a student does a procedure, they go extra mile, they take extra care in doing a procedure. So that shouldn't be a problem.
Shouldn't be a problem.
Yes.
That's good news.
And also from Ravi Menon, sir, I think that is an interesting question.
Oh,
Is
Ravi Menon, yeah, I know.
odontopaste really required?
Sorry?
Is odontopaste really required? Or can we just settle with non-setting calcium hydroxide in between appointments?
Okay, Ravi. Nowadays, I think so. The giving intracanal medicament is not prescribed or not used nowadays because it's more of single appointments and 2 appointments. Okay, you can go for there's not much evidence suggesting which is better between calcium hydroxide or odontopaste. Okay, only if there is a persistent lesion there, persistent periapical lesion, or if there is a discharge from the root canals, you can go for an intracanal medicament like calcium hydroxide or odontopaste. If there is no discharge and the canals are thoroughly clean, disinfected with sodium hypochlorite, then there's no need for placing any intracanal medicament. Place a temporary restoration and call for next appointment.
Hope that clears the doubt. The next one, Silwen, she asked, would you suggest your favorite rotary file system? Thanks and take care.
My favorite rotary file systems. We are using quite a number of rotary file systems here. We are using ProTaper Gold for regular use for students as well as staff. Then you also using Wave One. Try Reciproc also here, and we also using now True Anatomy, recently introduced. So more, I've been working all the while with ProTaper Gold, ProTaper Next, and now Wave One. Yeah.
But sir, for the student, do you think it's better for the student to learn how to use a rotary instrument, or is it really important for the student to learn how to use the manual file?
During the training stage, when they are doing extractor tooth, we train them to do both with manual files, okay, the traditional manual files, as well as with the rotary systems, okay. So using a manual file increases the tactile sensation, okay. So we advise use manual files in the initial stages. As we go forward, yeah, rotary files more often. So but if you look at which is more efficient, obviously rotary files are more efficient, okay, and more predictable results when compared to
manual.
Yeah, manual.
So I think we have ventured too much further into the technical world. So now I have a friend asking me a really kind of weird questions. He asked why the dentist put a cotton into my tooth. during the treatment?
Okay, in between the appointments, okay, sometimes we place a small cotton pellet between the appointments, and over which we place a temporary restoration. This is just to prevent the temporary restoration going inside the root canals and blocking the root canals. So we place a cotton pellet.
So the cotton pellet is not going to do anything.
No.
Yeah, because he's worried, like he's afraid that he might seen a quack dentist for putting the cotton pellet inside the tooth.
Yeah.
So
There's one more question there with Saurabh Agarwal. In your experience, what is long-lasting, an implant and RCT with crown? As I again say, means we quote the evidence. Okay, the survival rates are quite similar for RC treated tooth with crown and implant. Okay, if you look at the survival rates for 10 years, okay, for RC implant, I think it's 75% to 94, whereas an RCT treated tooth is 82 to 94. Okay, and an RCT treated tooth is a natural tooth. Okay, it's your tooth, and you will have still, if it is there retained, you will still have this natural sensation when you are biting. Yeah, and it will braid the adjacent tooth or cut the adjacent tooth less. Okay, so it can stay for a longer time only if the dentist feels that this tooth cannot be salvaged or saved, then we go for replacement.
Yeah, so anyway, your original item, your factory item will be the best.
Yeah, sure.
Yeah. Then next question from Leong Peng Teo. So for shaky molar teeth, can we still do root canal on the tooth?
Okay, that's an interesting question. Okay, sometimes, okay, if the tooth, the bone or the area surrounding the tooth can get infected. Okay, that means if the infection has spread from the tooth, okay, if the infection has spread from the tooth into the pulp tissues, from there goes to the periapical area, the bone which is surrounding the tooth may become mobile. Okay, sometimes this mobility may be due to the gum problem itself. Okay, so if we can take care of the infection which is there within the tooth, okay, the body will heal the infection which is around the bone, and the mobility might be reduced. But before we start the treatment, we will assess if it is this infection is because of the tooth decay or it's because of the gum problem. If it is because of the tooth decay and the tooth is like just marginally mobility, after root canal treatment, usually the mobility will decrease.
Okay. So I'd like to address the question by Muhammad Nazrin.
Okay.
He asked, is there any difference in the outcome of single visit and multiple visit RCT? Does single visit RCT recommended for tooth with periapical lesion without swelling?
That is what I'm saying. There is no difference. Current evidence suggests that there is no difference in the success of the root canal treatment done in single visits or multiple visits. But nowadays they are encouraging to do single visit root canal treatment for any tooth which has been infected but without periapical lesion. Okay, without periapical lesion. So as less times we open the tooth, more will be the success rate of the root canal treatment.
So now with all that in our minds, I want to ask, is there any instruction you will give? Is there any difference after we have a root canal treated tooth in our mouth? Is there any post-RCT instruction for the patient?
After root canal treatment, as I said, the post-operative instruction is that usually the tooth may be numb if there is anesthetized. Okay, try to avoid eating from that side, or else there are usually no post-operative. If there is no anesthesia given, no post-operative instruction. We just ask them to take the medication prescribed if it is prescribed. Okay, if they have any pain on biting or the pain continues for more than a day or something like that, even after medication they have taken, we ask them to report back to the clinic.
So meaning that if everything goes well, their tooth will perform just as the original tooth.
Yes.
And there's nothing needs to be
done.
Okay, which is good news actually.
Yeah, good news. Let's see if we miss any of the questions.
Yeah, we have a new question from.
Yeah, let's see above.
LV.
The Gutta question. Yeah, Akmal Mazani.
Okay.
By Akmal Mazani. So he asked,
is there any substitute material for Gutta Percha?
Yeah.
Yeah.
Yeah. There are nowadays coming bioceramic material nowadays, and then there is a guttapacha and a resin combination called Resilon is also there. Okay, which is going, which has shown already good results. So we have Resilon, then we have bioceramic materials to fill the root canal completely. Yeah, there are few, but guttapacha is being used for a very long time. Okay, long proven history, and it is quite inexpensive.
Yeah.
Okay, and the results are very good over a period of time. So it's still being used for filling the root canals. Yeah.
Okay, so just now we saw there's a new question from LV Hui. So, hi, doctor, do crown really needs after RCT or anterior tooth? I think we
Yeah, I would like to answer that question because there's an anterior tooth there. For anterior tooth, usually after root canal treatments, crowns are not required because they are not very much a load bearing. If you can do a very good tooth color restorative material restoration should be sufficient. Only if we think that the tooth is very weak, broken down, then we advise a crown.
Oh,
Hope that clears the doubt.
yeah.
Also,
So I
there's
think with that question answer, we have drawn to the almost to the end of our today's show.
shall we get one more question, sir, before
Sure,
we end
no
the
problem.
show? Yeah, so Weber asked, should I worry about root canal infection after the procedure? Is that a worry?
No need to worry because the main aim of root canal treatment is to disinfect. Again, I said, so trying to remove all the infection from the root canal and seal off so that reinfection does not occur. So there's no need to worry about anything after root canal treatment.
All right. And maybe the last one. Bunny asked, during RCT process, what can I do to prevent an infection, sir?
I think she asked this question more in an operator.
Yeah,
point
operator
of
point of
Okay,
view.
operator.
Yeah.
So what needs to be done to
Mhm.
prevent infection? Okay, obviously, when you're doing a root canal treatment as an operator, try to clean and disinfect the canals as thoroughly as possible. Okay, by using sodium hypochlorite. Okay, that's a mainstay of irrigation or disinfecting of the root canal. See that all the canals have been identified, measured accurately, and clean and shaped thoroughly. So if you can do this one, then we should be able to take care of the infection.
Okay.
Okay.
So wait, it's 4.
Yeah, and we still have.
Yeah, we still. Is it okay if we
Yeah,
proceed with
sure,
more
sure,
questions?
definitely.
Yeah, okay. So Muhammad Nazrin asks, does all cracked tooth suggest to be extracted?
Okay, so if we look at the recommendations of American Association of Endodontists, the cracked tooth has got various degrees. Okay, it can be a small infarction or a crack. Okay, it can be a cracked tooth or it can be a split tooth. Okay, only if the crack extends below the gum or below the gingiva, or else even though if it is involved the pulp tissue but it is gone slightly below the gingiva, or else the crack splits the tooth into two halves, then only we need to extract. If the crack is only not extending below the gum and the part can be separated, okay, still we can go ahead with root canal treatment and crown. If it is not involving even the pulp tissue, we'll just go for normal restorations. So it depends upon the extent of the crack.
Yeah. Okay, so I think that's it for today.
Oh, there's another more actually.
Yeah.
Yeah, we
Is
forgot. There's Lee Wei Ping. Question from Lee Wei Ping.
Oh, vaping, yeah.
Yeah.
Vaping.
Greetings, Dr. Kalyan. As an endodontist, would you advise RCT for Lyons Premolar?
I come across many Lyons Premolar here. Okay. For your information, Lyons is from Penang. Dr. Lyons. Are you aware of that one?
No.
Yeah, it's named after a dentist from Penang, Dr. Lyons.
Oh.
Okay, so Lyons premolar, that means is the small projection which is there on the occlusal surface of the lower premolars. Okay, so into these projections you will have the pulp tissue also projected. So there is quite common that because of this projection of pulp tissue into the occlusal aspects or the top aspect, they may wear away over a period of time and the bacterial infection may enter. Okay, and one more Tricky part with Lyons Premolar is that the roots which are formed at the apex, they are not completely formed. So you may have a blunderbuss canal. So doing a root canal treatment on a Lyons Premolar with blunderbuss canal is difficult. Okay. But if it is infected and we can save it or salvage it, yeah, definitely I'll do a root canal treatment.
Okay. The main goal is to save the tooth.
Yeah, save the tooth.
All right.
All right, we have another question from Sheikh Abdul Wahab. He's asking about the first year course for MBBS.
That's a difficult question for me. I cannot answer.
Is it different?
Yeah, sorry.
Yeah.
So maybe we can save that questions and
Yeah,
ask
we can
another
answer that
expert
later.
from
Okay.
our colleagues to answer that later. And I think that's it for today.
That's it for today. Okay.
Yeah.
So that concludes today's discussion. Thank you so much, Dr. Kalyan,
Yeah,
for
thank you so much. We really learned a lot today.
for answering the questions and also sharing your knowledge. And to those watching, thank you so much for attending and also joining us. Yeah.
Yeah, also. And don't forget to subscribe and like our Facebook and Instagram page. And also, we hope you learned something today. So do drop us a message if you have some topic that you are interested to know, so we might make it into our future content. So I think that's it for today. See you guys.
Thank you, Theo. Thank you, Amalia. I hope I could answer all the questions you have asked. And to all the viewers who are there, I would like to wish you in advance Happy New Year. Okay. Have a great 2021.
Yeah. Happy New Year, everyone.
Happy New Year, guys.
Okay.